All right. Thank you guys so much for staying. I really hope that we can give you guys some value. I'm Dr. Jessica. This is Dr. Joel from Mission Move Physical Therapy, as they already said. We are physical therapists that work with active individuals mainly. That's what we love to do. We love to keep you moving, keep you doing all the things that you love, whatever that may be. If you guys have any questions throughout this little segment here, please put them in the chat. We would love to answer them for you. So don't be shy. Ask anything that you guys have, and we will answer them for you. So today we are going to talk about knee pain. We see knee pain all the time as physical therapists. It's super common. It can be anywhere along the knee, below, on the outsides, above, anywhere around there. And something that you guys need to understand about knee pain is that oftentimes it comes from either having a lack of strength around the knee, so in the quad, or some other muscle surrounding the knee, or it can be from a lack of mobility or flexibility as well. So we are going to cover both of those things and teach you guys how to create a balance between those two things. A lot of times when people have knee pain or other problems, they just think, oh, well, let me just stretch it. Like, let me just stretch the crap out of it, like so much. And it's like, cool, like that may help, but yeah. But oftentimes there's also a strength imbalance there as well. So we're here to mesh those two things together and teach you guys how to do both to create a healthy knee joint. Okay, so yes, common misconceptions about knee bending. You may like kind of get that crankiness when you get super low into the knee bend. So you might think, oh, maybe I shouldn't put my knees over my toes when I squat. That is not true, okay? So it's okay to put your knees over your toes. It's okay to go to that end range, and it's actually really healthy for your joint to go into that end range. It's good for the joint to be exposed to those end range positions. And just know that when you train your knee in those end range positions, like slow and in a controlled environment, then when you're in an uncontrolled environment, like dancing, then your knee joint is much more likely to accept those positions, okay? So that's why we think train it in a slow, controlled, full range capacity so that when you're in those mid ranges or going quickly in and out of the knee bends, then your knee is not like, what the heck is this, okay? It understands what's happening and it's accepting of it. So you guys, we're gonna do a pre-test. Our pre-test is going to be just a regular old squat. So when we teach people how to squat, I usually say set your feet about shoulder width apart. For women, we usually are more comfortable having our toes out a little bit. Usually for men too, it just depends. There's no perfect position of your toes. You just kind of got to find out what feels comfortable for you. And then you're going to always engage your core a little bit, right? So that slight little tilt of the pelvis, keep your core nice and tight. You're going to push your hips back just a little bit and then go straight down. Let those knees go straight out over your toes. You can put your arms forward, get as low as you can, and then come back up, okay? So I just want you guys to take note of how your squat feels, what you feel in your knees right now. Do you feel tightness? Does it feel like your knees are going to explode? Does it feel comfortable? Do you feel tightness elsewhere in your body? Just kind of take note of what you feel. Yes, we're getting there, right? Just kind of do a few, just understand. Yes, you may hear cracks. That's okay. That's normal. It doesn't mean you're broken, okay? And so just remember what that felt like. We're going to show you guys 4 drills that we want you to kind of just adopt as part of your warm-up or your cool-down for whatever kind of exercise you guys do. And then we're going to do a post test, and hopefully your squat feels better and more comfortable, okay? So the first drill that we are going to do is a straight leg raise, but we are real picky about how we want these done, okay? So I'm going to go ahead and lay down. So the leg that you are working here is going to be the straight side, all right? You can bend the other knee, and you can kind of use that to be your target height, okay? So what you want to do before you move is you want to push your knee as straight as you can possibly get it and lock the knee joint out completely, okay? So super straight. Yep, you want to almost think like pop my heel up a little bit if I can. You want to hold that really tight in the quad here, and then you want to slowly come up to match the height of your opposite knee. So you don't want to go too crazy with height here because then you're going to let momentum take over. And then you're slowly going to lower it all the way down, okay? Where we see, and then at the bottom there, go ahead and relax the quad. where we see people cheat, okay? So usually they're pretty good in the beginning. They come up, they're good, they're good, they're good. Right here, when they go to switch to come down, we'll often see this, a little tiny knee bend, okay? You don't want to let that happen. You want to hold that quad squeeze. And then the second place people like to treat is right at the end here. Instead of reaching their calf down for the ground, they reach their knee down and they kind of bend right at the end there and just cheat right there, okay? So no cheating, okay? So squeeze it tight, up, nice and slow and controlled the whole time. And then nice and slow back down. I want you guys to try to do 10 on each side. 10 on each side. I'm going to come around and make sure we're not cheating here. Give me that good squeeze. Good. Nice and tight. I should see and feel those quads popping. Good. Yes, you are popping. Good. Relax at the bottom and then retighten every time. Let's see. Good. Nice and straight. Got those quads going. Looks good. Yep. Right back down. Relax it and then re-squeeze. Yeah, great. Good job. Good job, good job. So make sure you guys do a few on each side. You should feel some quad fatigue start to set in there. Typically we'll have people do more than one set, but just so you guys can get a good feel for what it feels like to get your quad really working. Yes. Oh yeah. So when you feel really good doing 10 without weight, then go ahead and add a little ankle weight on the bottom. That's going to make it much harder. And since the weight is so far away from your center of gravity, a little goes a long way. Okay, so 1 to 3 pounds feels like 20 sometimes when you're doing this. Okay, well we're going to need to go on the wall. Yeah. I love it. Okay, how do we feel? How do we feel doing the straight leg raises? Did it feel harder than you thought? Easier than you thought? Yeah, a little shaking. That's okay. That's fine. Are we good with the straight leg raises? Okay, so that's a really great exercise that you can use for a warm-up, cool down, whatever. Okay, so definitely if you're having any kind of knee pain, that would be a great place to start. All right, the second one we're going to do is called a couch stretch. It's called that because you can do it right on your couch. So basically this one is going to address the quad flexibility and mobility. So this stretch can be very intense, okay? So just keep that in mind. But basically what we're doing is we're going into a half kneeling position, and then we're gonna make this more intense by elevating the back leg, AKA putting the knee into deeper flexion, okay? So you guys can use a wall or a piece of furniture or anything. So you want to get into this position here. Hopefully that's visible. So opposite leg up, the one you're stretching is down, and then that same leg is elevated in the back. You want to kind of tuck your butt underneath you just a little bit to increase that stretch, and then make sure your torso is up nice and tall. And that's where that stretch is going to come from. Okay, so if you want to make this more intense, then you would take your knee and you would slide it back towards the surface that you're using, okay? If you want to make it less intense, keep your knee farther away, all right? So that's how you kind of make that tailored to whatever you are ready for. So then once you get up into that, yeah, if you can't go really, really high, you can use anything to elevate your foot, a yoga block, a piece of whatever, a couple pillows, whatever you got laying around. So any amount of foot elevation is going to make this more intense, any amount, okay? And then in this position, yep, there you go. You're just going to hold it. You can kind of play around with your pelvic position by tucking a little. You can also take that back butt cheek and kind of give it a little squeeze. That might also increase the stretch a little bit. Just kind of, yeah, squeeze the one of the knee that's down, that butt cheek of the knee that's down. Squeeze it, hold it. I usually say to do like 30 seconds to a minute on each side, and you can do that twice, okay? So go ahead and do that on both sides. You should feel this stretch all the way down the front of that quad, maybe into the hip flexor a little bit. You love it? Good. Yeah, people usually, like, it can be uncomfortable while you're down there, but when you stand up, people are like, wow, ooh, I feel so free. Like, my knee actually moves. This is awesome, okay? So yeah, go ahead and just hold that. Make sure you guys do both sides. And then we're going to do a little switcheroo here.
All right, so that last one, I'm Dr. Joel, by the way. So that last one, yeah, making sure you hold it like Dr. Jessica said, and just feeling that in the quad is really important. So that first exercise, we contracted the quad, right? That's getting your quad going. Then we started stretching the quad because we don't want to inhibit the motion. And so this next one that I'm going to teach you is on how to get end range of motion into flexion, right? So we're working on getting down into that squat position for how to get less knee pain with that. So this next one is called the knees over toes stretch. And I'm going to use this chair, okay? And so this is, again, and Jessica mentioned this at the beginning, is a common misconception that you shouldn't get your, like, it's like if my knee hurts, I'm just going to avoid bending it, right? But then it's like, how do you ever go up and down stairs? How do you ever pick anything off the ground? You have to bend your knee. And so the way to reduce the pain that you may get, or just a little bit of discomfort when you bend your knee, is to actually do it more, right? And so it's just like anything else. Like if you were looking to run, you wouldn't run less, right? You have to do it more, okay? So this one, we like to use a chair because, you know, unless most everyone has a chair. Okay, so so you're gonna put your foot up on a chair like this, and then yeah, I trust you, you're fine. And so you're going to try to get your knee to touch the back of that chair. So you can kind of get it up in this position, and then you're going to push forward, right, over top, just like that, trying to keep your heel down. It's nice to be up on a chair because you can kind of get your body weight over top of it and push forward. What you're trying to do is get your calf to approximate your hamstring here on the back of your leg in this position. Okay, so just back and forth like this. Okay. Yeah, it's more of a push down. It's more of a push down than a push forward. Okay, so just like this. Now this, for a lot of you, this may be hard to do at first, right? Because you may not be used to bending your knee this much. So it's okay if you just get to there a little bit, right? The goal isn't to get as far as you possibly can the first time. It's just like ease in and out a little bit, ease in and out, okay? Back and forth, just nice and easy. If you don't have a chair and you're doing it on something lower, you can do it on something lower. Okay. Okay. Sure. So if you're doing it on something lower, so this is the way to do it on the chair. Push all the way forward, just like that. If you're doing it on something lower, you can even just do it on the ground. I'm going to remove the chair for just a second. Then you kind of almost need to be in like a lunge position like this. Okay. So just down like that, okay? But again, the key to this is this takes a while to actually achieve a lot of range of motion. So it's like even if you're just here kind of moving forward, you're kind of introducing more flexion into your knee on a chair, on an ottoman, something like that. That's the goal of this one. All right, hopefully everyone tried that at home. Yep, both legs, obviously. You want to be even. Let us know if you had any discomfort with that. Don't be surprised if you had a little bit. That's okay, right? Again, you're trying something new. Okay, so we've done some strengthening, we've done some stretching, we've did some like actual mobility in the knee joint. The last one is to kind of put that all together into assisted motion for a squat. Okay, so I'll use Jessica here, and so Jessica's going to demonstrate. So this is called an assisted squat, right? So if you're having trouble doing a squat and you're just here like this, you might feel like, oh, this is all the further I can go. But if you can have somebody help you, or you can use some straps at home, you can even use a TRX, you can use bands, you could use, like, if you have like a pole or a column in your house, you could use a door jamb and kind of allow yourself to go into full flexion. So I'm going to hold on to Jessica's hands here, right? So she could be holding on to something. We don't have anything to hold on to, so I'm going to hold on to her. Counter, something. And so go ahead, Jessica, and go down into that squat, right? And so if you are normally just stopping there, you can go further, right? Because I can support her all the way to the bottom. So you can even have someone at your house help you with this, okay? And then when you get down there, kind of shift back and forth. You'll feel it in your hips a little bit. Rotate back and forth this way. There you go. Okay? And then that allows you to get down, because if you lack some of that mobility, you can come back up. If you lack some of that hip and ankle mobility, you may feel by yourself you can only get to there. But if you have something to hold on to, you can get even further. All right, Kelly, bring yourself forward a little bit more. Yeah, yep, get more onto your toes. So you want to be here. Yeah, more onto your toes, right? Yes, remember, we're not afraid of knees over toes. That's what keeps you from actually getting knee pain, is if you can get down here as opposed to being way back here. Yeah. Yeah, yeah. All right. Let's see what the stars of the show got. Don't mess up. You do. And then separate your feet a little bit and point your toes out, right? So we always say, like, the proper squat is like what a 1-year-old baby does, right? Like, they go down to pick something up on the floor, they just kind of go straight down, they grab it and come right back up. Yeah. She's got a lot of mobility there. She's got a lot of mobility. Yeah. Okay. So that's the last one. We did those 4. So then the thing is let's do the pose test, right? We started with a squat. Let's end with a squat. And so just do the same thing that you started with feet wide, toes out. And then I want you just to go straight down and come back up and just be like, do I have a little more mobility there in my quads and my knees? Can I get down into that squat a little bit easier than I did before we did all those? Okay? Yeah. So that's what we're looking for. Right. Yeah. Yes, Izzy has reached a new low in a good way. Yeah, so thanks for watching our little workshop. Dr. Jessica and I, as she said in the beginning, we work at a practice called Mission Move, and we're all about treating active people. We want people to keep moving. We think movement is the key to health, right? Like dancing, running, cycling, lifting weights, all those things, right? It not only helps us physically, but also mentally, also spiritually, all those things that allow us to be healthier humans, we know that exercise and movement play a big part of. So if you're someone who is having any issue that is keeping you from moving, we are the ones that can help you. We'd love for you to reach out to us. We do free phone consults. If you just want to hop on a phone call, let us know what your situation is. We'd love to talk to you about that and see if we can help keep you moving so you can stay healthy. Okay? Yeah. So thanks so much to Vibe, Kelly, and Allie for having us out. Our website is missionmovept.com. We're also at missionmovept on Instagram. Those are the two. Follow us, like us. We're on YouTube. We have quite a large YouTube channel too, so if you want to find us on there's a lot of instructional videos on there. So going over some of this exact same stuff. And then call or text us. If you go to our website, there's even a button there to text us. If you're just like, I don't want to call these people, I'll text them. Text us. It's fine. Okay?
So thank you guys so much for doing that. That was really awesome. It was very informative, and it's good to know. It's good to know all of that stuff because we do a lot of things with our knees in all of our classes, and it's good to know that these stretches are going to help us with that. So yay, and yay for you guys for doing it with us and joining in. I was here the whole time learning and doing it over here. I was also in charge of taking pictures and answering questions. So it was a joint effort, but thank you guys so much. We hope that you'll come back. It was great. Yes, thank you guys.